All right. Welcome back, everybody, to another episode of the Rep by Rep Strength Podcast. Today, I'm sitting down and talking with Dr. Christopher Tabor. Doc, thanks for just sitting down and talking with me today. Why don't you go ahead and give everybody an introduction about where you're at, what you're doing, that kind of thing.
All right. My name is Chris Tabor. I'm the Graduate Program Director at Sacred Heart University in the Department of Exercise and Sports Science. So I run the performance side of our program, getting students ready to go into the field of strength and conditioning or sports science, and work in a couple of different levels, whether it's high school, college, or professional. And then I also coach weightlifters. So I run a weightlifting team here in Connecticut and help those athletes to compete nationally and hopefully get some to the international level as they keep developing.
Yeah, I saw one of your lifters the other day squatting, was 141 kilos for sets of 5. Female, yep. Is that right?
Yeah, she's doing great. Yeah.
Has she entered a competition yet?
Yeah, she did her first national meet in December. So she did the American Open this past December for USA weightlifting.
Nice. What weight class?
She was 87 plus, but she's dropping down, so she's right at the top. Okay. We just had her train through because she already made nationals. She'll be cutting down 87 kilo class for the national event.
Okay. Yeah, so you've got 87 kilo, and then you've got 87 kilo plus. Is that correct?
Yeah.
Okay, yep. Gotcha. All right. Yeah, I was talking to Stuart Young a few weeks ago, and he's got a couple weightlifters that he works with. I'm sure more than a couple that I just don't see, but some that I follow. And I think he's got one, Kat Lucas, I think is her name. And I want to say she's in the 87, but I can't remember if it's 87 or 87 plus. But
yeah.
Anyway, yeah, man. So I just wanted to talk to you about stuff that you're already doing. And I think last time we talked, it's probably last year. I was talking to you about basically readiness and how to implement that with tactical population. And, from conversation we had, I've been utilizing that where we've been basically utilizing a stoplight system. So athletes come in and they just perform 3 vertical jumps on a just jump mat. And if they break a record, they're going to, they might add some extra sets, and we're going to chase weight that day. And if we have the yellow, where there's like a 5% drop off, we'll adjust the sets reps accordingly. And then if it's a red, if there's a 10% or more decrease, then we will cut training quite a bit for the day. But anyway, since implementing that, they've been responding really well to that. So thank you for the readiness discussion that we had. And can you get into a little bit about readiness versus monitoring and kind of implications of that with athletes?
Yeah, so monitoring really is the long-term process of following an athlete as they train and then using consistent measurements over time to see how they're adapting, hopefully in a positive manner. But it also lets us know if things are trending in a negative direction and if we need to make any changes to the plan. Now, readiness is essentially an acute measurement. It's the day-to-day fluctuation and where the athlete is, and that's kind of in the moment. And so that can be affected by a wide variety of factors, and you're kind of adjusting for the day, whereas monitoring is adjusting over time, because one data point in readiness that's out of the ordinary is not really a big deal. You might see that they're in the red when they come in one day. They might have slept wrong. They might have, only gotten 3-4 hours of sleep. Could be really stressed out. Maybe something happened in their life causing that day to be bad. That's an isolated point. So maybe just chalk it up to a bad day. And then the next day they come in, they're right back to normal. I'm not really going to worry about that individual data point. But if I see an athlete progressively trending down over time, and we're starting to see compared to their average that they're constantly getting lower, they're reporting being sore all the time, feeling not really that great, that's when we want to make some changes in the monitoring process, not the tests that we're using, but what are we doing with their plan that's causing this athlete to not be adapting in the manner that we would expect? And that's when you evaluate what they're doing. Too much intensity, too much volume, not enough recovery days. Are there outside factors influencing that person? Personal life issues, stressful job, anything like that could cause long-term negative adaptations that we want to try and avoid and adjust.
Gotcha. So with those, like you said, one data point's not really area for concern. How many data points in a row before you would make an adjustment or a change?
I would say if consistently between weeks, there's like more than 2 weeks of trending negative data points, then I would start to talk to the athlete. So,
Gotcha.
after 2 weeks, if they've come in 3 weeks in a row, there's something negative showing up in their testing data. We want to know that. We want to know what's going on. But 2 weeks could be that they did a really hard training and they have residual fatigue. And then in week 3, it comes back to normal. I would have just looked back at what we did or what they were encountering at that time and making sure that we combat that with some recovery to get it to come back up.
I see. So is there a main variable that's the driver for, a downward trend? So is it more related to volume or intensity or kind of a mixture there?
It could be a combo, but I would say for most people, it's the volume they encounter is the largest driver of fatigue because
Okay.
that's mechanical work completed and total work done in a week. And often athletes think, I have a day off, I'm completely back to normal. But sometimes those volumes will persist in days and it could be weeks after. Like if you do a really high volume block of training for someone, they could experience fatigue for, 7, 10, 14 days after the previous block ended, depending on what you really did in those, weeks 3 and 4 of the last block.
Yeah, that's the main thing I've been, um, educating guys on here on the tactical side is the delayed training effects, and then how long those can be before they summate. And
Mhm.
a lot of these guys, just by nature of, I think nature of the job, kind of certain personalities select and choose to do this kind of work.
Mhm.
Um, they're more of the mindset of if I'm not wrecked or destroyed or sore, then I didn't have a good workout.
Yeah.
And trying to educate them and talk with them about there's going to be days where I don't necessarily want that degree of soreness
Yeah.
every day. Like there's going to be times where you're sore, which is fine, but it's not like we use that as our metric to measure good or bad training. So
Delayed onset muscle soreness is the worst tracking of whether you had a good workout or not. It's
mhm,
not indicative of a good workout. So we try to educate people not to chase soreness because it might indicate that you worked a particular muscle group that you intended to work,
mhm,
but it's not a gauge of my workout was effective because I'm sore.
right.
You're sore because you worked out, but you weren't chasing that. That's just a byproduct of training.
Yeah. Yeah. I think there's the other thing that I talk with these guys about is, hey, you're training more than just your muscular system. We've got to consider tendons and ligaments, nervous system fatigue, all of these other factors and other systems that they have not been educated on in the past. And when it's brought to their attention of, you know, tendons and ligaments are going to be behind the muscle. The muscle's, going to recover much faster, be ready to go. And, due to the nature of the environment, they're always wanting to push, push, push,
Hmm.
which in turn is not always necessarily in their best interest. So,
Yeah.
but yeah, so kind of going off of that point, talking about soreness and whatnot, I read your AEL, or excuse me, not your AEL, but your tempering paper that was published
Yeah.
last week. And, it's something that we've been utilizing with our guys for about 6 to 8 months and
Hmm.
positive results so far. But what were your findings in the tempering?
Yeah. So we used it with linemen, offensive and defensive linemen, and collegiate football players. The reason we use this population is because they had already been doing it, so they weren't naive to the tempering. So we could get rid of that learning effect. They've been doing it as a part of their normal training. We wanted to explore the effects. So we did a tempering group and a stretching group. So each person did both treatments, and then we looked at lower body power production via vertical jumps. We looked at maximal force production with an isometric mid-thigh pull so that we could standardize it for the study. And then we looked at range of motion in 4 different flexibility assessments. And then we did soreness, which was their perceived soreness, subjective level. So, because of the small sample size, we didn't find significance in any of the values, really. We found that soreness is quite different. It was actually 4 times better in improving soreness in the tempering compared to stretching. It was about 10% better in stretching, which is still pretty good considering it's just stretching. But tempering was around 40% feeling better. So that's a large drop in perceived soreness. Other big outcomes, force production was unaffected. So isometric mid-thigh pull didn't drop off between tempering pre and post. And then it also didn't seem to affect jump height. So their power production was maintained even after using it. So acutely, you can use it to feel better. And it doesn't seem to have any negative effect on performance. Didn't enhance, but the thing I was really searching for is that it didn't cause a decrement in either of those prior, just because of the mechanisms that are proposed. And then it did increase flexibility in one of the positions, which was the straight leg raise for hamstring. But again, small sample size, you're not going to find significance. We had to rely on some effect sizes to show what happened. But I find that a promising, future study that we could do is look at the effects of tempering over time on flexibility and possibly injury prevention.
Yeah. And I guess I should have prefaced this a little bit just for the listeners, but effectively this is, a metal, a chunk of metal that more or less, like I think what you guys used for the study was 59 kilos, but they have various weights. We have 50, 80, 110 pounds, and essentially you'll put it on a muscle grouping, and you guys did 30-second holds at each position. Is that correct?
Correct. Quads and hamstrings.
Okay.
Yeah.
So going forward, you said you wanted to, do some more studies along this line. Or you wanted to experiment with more teams, or who are you looking at?
Same team, but longitudinal study now to see the effects on these outcomes. So the recommendation from speaking with Donnie Thompson, who invented this, and also Chris Duffin, we got to the greater than 50% of your body weight. That's like what we were searching for, or around 50%. So these alignments, some of them were quite large. So 130 pounds or 59 kilos wasn't more than half, but that's what they had been using in training. Some people are just beginning, will probably use the lighter ones, like you talked about, like 80 pounds.
Yeah.
Once you get comfortable there, build up over time. We don't truly know what the long-term effects are, but if it makes you feel better and there are no negative consequences, I would continue using it if it makes you feel good.
Yeah, that's the thing I'm looking at too, is like the subjective feel there. I mean, that's the biggest thing that's important to me with the population I work with is if they feel better or they perceive themselves to feel better, then by all means, who am I to say that it doesn't work or whatever? Yeah. So far, the people I've been using it with really enjoy it. They hop up, feel more mobile, and just when you run along their back, there's a lot of pops and cracks, and they feel like they can move around a little bit more, and more prep. So anyway,
I think another important thing is that it's a passive modality.
Yeah,
like you're laying there, you're relaxing as much as you can, and someone is moving the roller against you. Whereas foam rolling, you're active against the foam roller.
Right.
And so I think the passive portion of being treated passively has a big effect. And especially as you use it more often and you become accustomed to it, you can relax more while it's being done. And that probably has a beneficial effect. You're still hitting trigger points. There are different models of body tempering devices you can use. And so I think it's a valuable tool. There's some evidence that if you feel better, like you're less sore, you tend to move better. And that might just be a perceptual thing for the person. So if you're getting a better movement quality from someone because they're not feeling as sore, and there was no negative effects on their performance, I mean, I would use it. It
Yeah,
seems like a win-win.
yeah. We've been, physical therapy office has their own set. I have a set down on the weight room floor, and I've been talking to the strength coach down at the 58th Sal, and you been following along with what Donnie Thompson's been recommending. So we've played around with calf, lat, QL. Uh, I've seen Chris Duffin when he's rolled it along the abdominals,
Hmm.
but I haven't got into that yet. I've seen how they'll use it with their chest and whatnot. But, anyway, it's something I hope more guys will start playing with and trying out,
Yeah,
and more labs will start digging into so we can see long term effects.
yeah,
But anyway, yeah, I was excited to see that came out because conversations I've had with people has been more of, well, where's research? Where's research? Where's research? It's like, well, as always, it's what we're doing in the weight room is almost always ahead of the research, you know,
yeah.
because
We collected this data pre-pandemic. We finished our collection. Spring break happened at school, and the
mhm,
week we came back, lockdown happened. So we were
yeah,
sitting on that data, working on it to get it published all that time. But with the craziness of everything, it kind of got pushed to the back burner. So
right,
we collected that study in 2020.
okay, all
So
right, yeah, that's well, good, yeah, that was good to see that. Cool. So what was the other thing I was wanting to ask you about? So I guess taking a step back, one thing I forgot to mention or ask you about was decay rates. So when we're talking
mhm.
about monitoring and readiness and that kind of thing, the population that I have will basically go out in the field for a period of time. And one of the things that's always concerning to this population is rates of decay of
Mhm.
strength or aerobic conditioning or whatever the case may be. What are some things you do with your athletes to mitigate that or to slow that process?
So these are some of them are theoretical, but it's basically based on, if you remove a stimulus, how long does it take to go back to baseline?
Hmm.
And the good thing to remember is that the longer it takes to build something, the longer it will take to go back to baseline. And
Okay.
so some of the longer adaptations are things like your VO2 max, the endurance related to that, maximal strength, somewhat hypertrophy is a long lasting because it takes a while to build those tissues up. For your VO2 max, developing your heart musculature takes a while for that to grow and become larger. It's
Hmm.
going to return to baseline slower. Some things return quicker, in the midterm of amount of times, like 2 weeks, you have critical enzymes that are related in energy, production. And then in the short term, things that come back to baseline very quickly are things like speed and power, items that need to be trained quicker, but they can also be developed quicker because you can peak them more quickly. So when you're considering these rates of training for your population in particular, you're thinking once you leave, you're moving into a situation that might be suboptimal for the development of these qualities because you might have little to no equipment depending on
Hmm.
where you're going. And what you're trying to do is slow down the decay, maintain what you have, or maybe improve some qualities that are possible while you're out in the field.
Hmm.
And so what they've found, specifically for like strength and hypertrophy, there's a minimal dose of training that you can do to maintain those qualities. And for strength in particular, it's about once a week. As long as you're training that quality, you're hitting it about one time a week, you can maintain your strength for 12 weeks, they've shown, from one training session a week for each individual group you're trying to train. So if you think of like a push pull or
Hmm.
something of that nature. Hypertrophy is similar in that you can get away with minimal training, but your hypertrophy maintenance is going to be volume dependent. So you're probably going to need to put some work in that is working closer to failure. You don't always have to fail, but if you do a couple hard sets of the muscle groups you're trying to retain per week, that's probably sufficient to maintain your muscle mass. while you're in a training environment. And it doesn't always have to be with weights. There's value in doing body weight training if you can. And then for endurance performance, this is going to go very slowly back to baseline. So as long as you're doing some form of cardiovascular conditioning, whether it be, marching, running, jogging, things that you can do out in the field, that will be maintained at a base level for a longer period of time.
Yeah, and that's 2 points I wanted to touch on was, a lot of these guys that come here, they have a training age that can effectively be 0. And some of them have been training for a while, and they might have a training age of 7, 8, 9, 10 years. But anyway, that's one aspect, is understanding, basically educating and getting them to understand the training process. And then when we're talking about strength, getting clear on what I mean with them versus about what strength is. So a lot of them will, they'll go to their local CrossFit box and they'll follow the prescriptions of the weight, adjusted or not, and they'll basically stay at those weights for an extended period of time. And they've never pushed, again, a relative term here of, they've never pushed heavy weights before. So getting them to understand the process of strength, of basically always forcing the body to adapt to a new stimulus, but doing it in a slow, progressive manner, so it's as safe as possible for them. Is that, when you're talking about strength, and we're looking at explosive strength versus absolute, etc., do all of those have different rates of decay?
Yes, they're all going to be a little bit different. So the 25 days plus or minus 5 days, which is the common in the literature, that's for maximal strength. And so that's like what you would consider your 1RM, is the easiest to understand. But that's only one form of strength that exists. And then you have your other strength qualities underneath. So you mentioned explosive strength. That's power. That's moving a weight as quickly as you can. So that would be like an Olympic lifts. You can also train that with plyometrics. And so that's important for critical situations that people need to get in. And so that just needs to be maintained with a higher level of frequency if you want to maintain that quality. So it's something that they should be touching on. And then you have what you would call strength endurance. So this is your ability to sustain a power output over time, or a work rate over time. And this is what people think about when you're doing repetitions. So you have a 12 rep max, 15 whatever repetitions you're doing for a given unit of time. It's being able to sustain for that. And that's also an important physical quality for the population that you're working with. And that's more of an intermediate type adaptation. It's probably going to be in the 2-week range if I would have to speculate. And that's because there are some enzymes that are associated with strength and endurance, buffering capabilities, being able to get rid of some of the metabolic waste products. And those ones are going to stick around a little bit longer, but probably not as much as maximal strength. And that's because maximal strength is a function of both your nervous system and the size of your muscles that you currently have.
Right. So if we need to retain our ability for maximal strength, is that, if we had to assign some percentages to it, would you say 90% plus for 3 singles would constitute, I need to do that once per week to retain what I've got?
I would say, once a week of training in a session, like once a week per the exercise you're trying to do for that given series of muscles. So let's say a back squat, and then another day you might deadlift. You might train one of those each a week to maintain that quality. And I would say anything higher than 80 to 85% of sets of 5 or less. And then you want to work to a pretty high level, but maybe not failing all the time. You might work to failure occasionally, but it's not necessary to go to failure to maintain your strength, as long as a high degree of effort is present. So this might be like an RPE of 8 or 9, but stopping short of failure. And 5 or less reps, 80 to 85% and above is going to maintain your strength for that given group you're working on a weekly basis.
Now, can what are your thoughts on developing these qualities concurrently versus having things blocked off, where you're only working one quality at a given time?
So that might work if it's like in the off season,
Yeah.
like they're back with you and they're not deployed and they're in an optimal situation. You might be able to get away with developing compatible qualities at the
Hmm.
same time, but maybe not trying to develop endurance and maximal strength at the same time, because they kind of compete with what you need to do. But compatible qualities would be good. But out in the field, you probably want to vary your training so that you can maintain those qualities to a different degree. So you might have a day where you lift heavy if you can, if you have equipment, or you modify to whatever you have, and then you still work on, let's say, muscular endurance while you're out. You're doing a lot more repetitions and you're focusing on that, basically adjusting to your scenario using what you have, because you're not always going to have a weight room. It'd be great if you do where you go, but not everybody has that luxury.
Yep.
So you might have to do a lot more body weight training, or short rest periods with more volume, just to kind of maintain what you have and use the equipment. Maybe do some partner assisted workouts. Manual resistance would be good. That's a way to maintain some strength. You have equipment around, so throw your backpack on, do some work with that just to add some additional weight and get some reps in, and that will
Yep.
help.
Yeah, I've been sending guys who are getting deployed with bands. So
Hmm.
it's the best thing as far as they've got long bands, short bands, mega strong, all the way to you know not a ton of weight, but it's more of, hey, let's use these for hypertrophy development, or on this day we're going to retain their strength. Because a lot of the times the question I'll run into with this population is, well, why the hell should I focus on max strength? Why is it good for me to get stronger? I feel like I'm strong enough.
Hmm.
So we'll have discussions about injury prevention, working at a lower economical cost. Would there be anything else that you would add to that as far as why it's good to get strong?
So maximal strength is your ceiling. That's the highest you can go. And then all other physical qualities related to strength fall below that. So that's essentially your top end. And if you can get stronger in relation to your body weight, which
Mhm.
is entirely possible, the stronger you become in relation to your body weight, the easier things become.
Right.
So you start lifting now, you increase your strength. Now your body weight represents a lower amount of your total strength. So you're going to be more economical at your given body weight. Implements that you pick up are going to be easier. And then other things that you've done in the past become a smaller fraction of the total amount that you can handle. So if before you could pick up, let's say, 200 pounds off the ground, and then you have to pick up something out in the field, and that item is, 100 pounds, that's half of your max. Now you go to 300, right? That's now 25% or less of your max. And you'll be able to do that more times. It makes you better out in the field because you don't have to use as much. You have a greater strength reserve, and you're probably working for a long period of time. It's very unpredictable. It's not something that might occur for 5 minutes. You might be working for an hour, two
Hmm.
hours. It's impossible to know what you might encounter when you're out in the field. And so you want to have that top end strength be as high as you can within reason. We're not going to just only work on that, but it makes everything else easier.
Right. Yeah. So you go to do a repetition day or a hypertrophy day, same concept. Is
Yep.
that you can crank those out easier.
Yep.
So yeah, I'm sure you've been tracking on the basically the I wouldn't even I think it's just a consistent argument or debate about what people have been saying about there either seems to be the Olympic lifting camp or
Mhm.
the trap bar jump shrug camp.
Yep.
And there's some guys that I follow who do, and I'm more in that area as well. I'm kind of gray on it where I'll do both. I don't really care. They're just tools,
Mhm.
and it'll depend on skill level, how much time I have these guys, and that kind of thing. What have you dived into any kind of trap bar jump shrugs from various heights versus hang power cleans, etc.
So this literature has been covered pretty well by Dr. Tim Sukamel. So
Yep.
he does a lot of jumping variations. He does a lot of weightlifting variations. And they've shown that you can get great success with weightlifting variations with and without the catch.
Mm-hmm.
And so you do get some advantages to having the catch in there, but people get injured, their wrists, elbows, shoulders get beat up. You don't always have to catch. It's a great skill to have. It's good to load. There's always the degree of effort that you have with the full lifts. When you're doing power cleans, you can't half do a power clean because you're not going to make it. So you have that. You have the displacement of the barbell, the work done. You have coordination, proprioception. But if someone can't, or you just don't have enough time, let's say you get someone and they're leaving in a month.
Mm-hmm.
Am I going to dedicate that month to perfecting someone's clean technique?
Right.
No. I'm going to load up a trap bar and we're going to jump with it because you can figure that out in about 5 minutes. And so I'm not going to spend that time. But if I have somebody for 6 months and then they're going to be coming back and working with me in the future, yeah, I'll dedicate the time to teach them because I can get them reasonable technique in maybe 2-3 weeks.
Right.
And then we'll use that. We'll also do the weighted jumps because why not? I mean, everyone's an either or. Mm-hmm. I'll use everything. I don't care. I'd rather have more tools in my toolbox than less.
Yep.
And you just get variation. That's what periodization gives you in the long term. So why not have as many things as possible to make someone better? And I'm not in either camp. I'll use everything as long as it works.
Yeah. Yeah, I'm with you on that one. I'll play with it all, and I might have a group of 20 guys in here, but
mm-hmm.
some of them might be doing trap bar jump shrugs, some might be doing hang clean high pulls. I mean, it just doesn't matter to me. I'm just looking for some sort of power output on that day.
Yeah, just driving adaptations. That's all that matters to me.
But yeah, so one of the things is the groupings will come in, and then you'll have guys that'll basically come in on their off time or do their own workouts, or they might just be here temporarily, and I'll see them doing various things. But one thing I have not seen that is obviously something that you're researching and doing is AEL.
Mm-hmm.
Would you mind explaining that and when and why and how it's beneficial to where you would program? Like, you wouldn't put it with a beginner, but
yeah.
If you could
so
just
AEL is accentuated eccentric loading. And basically what this means is that you handle a weight or a load that is in excess of your concentric 1RM. So this is typically the eccentric loading is higher than the concentric load. So you might lower 100% and then stand up with 70 or 80%. So the theory behind this is that you can handle more weight with an eccentric muscle action than you can with a concentric muscle action. It's hypothesized that you could handle up to 150% of your concentric max on an eccentric load. As far as I know, no one's tested that because I don't think anyone wants to do an eccentric max. But that's the theory. And if you're only training with concentric prescription, we might be underloading your eccentric capabilities. So AEL is tapping into that. Now, it doesn't always have to be maximal or supramaximal loading. That's what everyone loves because it's the stuff you see online. You have weight releasers on the bar. You're lowering 120% of your max and standing up with a light weight, and it looks cool. So everyone posts on Instagram and stuff. But we can also do submaximal. So you would have less than 100% of your concentric max, but the load is higher than what you're going to lift on the concentric portion. So you might lower 90% and stand up with 70%. That would still be AEL.
Mm-hmm.
And then we have some applications using a percentage of your body weight using dumbbells for jumps. And that's where intermediates are really going to come into play. Introducing AEL via dumbbell drops in counter movement jumps or even in depth jumps. And you're going to use, 10, 20% of your body mass. So not a huge weight, but it tends to make your jumps better and it improves your eccentric capabilities. Advanced athletes and strength and power athletes is where you're really going to see AEL used at the maximal and supramaximal level. And this is used for topping off your maximal strength, like trying to break through a plateau if you have a high training age, or trying to increase rate of force development and power output, because you do get some increase in elastic storage of energy, and it can make your concentric strength and power improved after using it, usually on about 3 repetitions. So on the first rep, you use it, and then you get this carryover on reps 2 and 3. You get some residual enhancement of those repetitions. And all of this is dependent on how strong you are. If you're weak, you're probably not going to get too much of a benefit because it's just too stressful. So the stronger you are, the more benefit you tend to get from an AEL loading that you use.
So is the 3 reps because past the 3rd rep you start to lose that residual effect?
Yeah.
Okay.
That's what we found. So we did sets of 5, and so we found from reps 1 to 3 a spike in the RFD and power output, and then it tends to level off or go down reps 4 and 5. So that's why we tend to use this for power and rate of force development. 5 or less reps, usually 3 is the best for this.
Yeah, and that's one thing that I'll discuss with people here is not all exercises are equally stressful to the system. So I don't want people to haphazardly apply things if they don't know what the hell they're doing. Case in point, I've seen guys here where they'll bring their own from home BFR, and it's just a hand inflate. It's not consistent, and they'll try to do something so it's not only placed wrong on their body. They don't have an accurate gauge. It's consistent throughout their exercise session. But when you were talking about counter movement jump versus depth jump or depth drop, can you explain that a little bit about what the differences are for? Because I'll see guys try to do some vertical jumps or drops off boxes or jumps to boxes, and I don't think they know exactly what they're trying to chase.
So counter movement jump is just your standard vertical jump. You descend down to the bottom of a jump and you come up off the ground. This is what most people would think of in a jump. And so if we're using AEL, you're going to grab a set of dumbbells, usually starting off around 10% of your body weight. You're going to hold them in your hands. And then as you lower to the bottom position, you're going to release the dumbbells onto the floor and perform your normal counter movement jump. Because of the added weight of the dumbbells, you store a bit more energy. And then when you release them, it'll actually cause you to jump a little bit higher. And so it's a pretty nice training tool to use as a low-level AEL to get people prepared for later seasons. It also increases your power output. So that's a viable option for the introduction of AEL once someone has a plyometric base. Depth jumps are what you would think of as the shock method. So this is an actual plyometric. You're getting someone to stand on a box of an agreeable height for their strength level. Usually the stronger you are, the higher box. You're dropping off, so you're accelerating your body weight due to gravity down to the ground. You hit the ground and you spring up as quick as you can. And so what you're trying to maximize here is a very short ground contact time so that you store energy and then you pop off the ground very quickly, trying to get and use that energy you got from the extra effect of gravity, and you want a high jump height. What we want to avoid on a depth jump is too much time on the ground. So if the box starts to get too high, someone will spend too much time on the ground, and even though they're jumping higher, that's not the favorable outcome. Like we want them to be quick off the ground and jump high. And you can measure this if you have force plates, or if you have the upgraded switch mat, you can look at the reactive strength index, and that's the relation of ground contact time to jump height. And so we want to maximize a quick transition so you don't waste any energy.
Gotcha.
When you use that with AEL, we use a short box to start. So you're using a low box, drop down, drop the dumbbells, and come up off the floor as quickly as you can.
Okay. And then depending on the RSI score, that might dictate what's most needed for development, or how do you guys use the RSI?
Okay, so RSI just by itself is no dumbbells. So you calculate
Okay.
RSI as only drop jumps. So you pop off a box, and you could drop down, jump off the plate, and you're going to get two measurements. One is contact time, the amount of time your foot is on the ground, versus flight time, the time you leave the plate. And you will get a score called the reactive strength index. And depending on what your score is, can be indicative of what type of training you need. So low score just means that you're not that strong for that given height, and you probably need just basic strength training. Then you have a mixed approach where your number is more intermediate, so you need a blend of strength and power training. And then a high number means you need power training. So that's basically how you break down the RSI number for each person. And we use this as a daily readiness tool for certain teams, certain
Hmm.
athletes. And so you can track RSI over time and see how people are adapting. As you get tired, obviously your RSI score is going to go down. And as you become more prepared, your RSI score is going to increase. And so that's a good measure of neuromuscular readiness for a given day.
Okay. So that would help a lot, I would imagine, off season, but especially in season, right? As far as
Yeah.
dosing and that kind of thing.
Yeah, multiple games or a lot of work being done, a lot of stress if you have a stressful environment. So this is going to let you know athlete came in, here's their normal number, and it's up or down. Up, great, getting after it. Low, is it too low, or is it, statistically different than what he normally does or she does? And then you make the adjustment from there.
Gotcha. And one final question, then I'll be done taking up your time for the day. But when you say statistical significance, there, like how much statistical significance are you talking? 10%, 15%?
So there's two ways to do this. You could look at a measure called the smallest detectable difference or smallest worthwhile change. These are some measurements that you can do. And based off your population that you're working with, you can come up with cutoff values and basically say, if something falls out of this level, I will make a change to the programming. That depends entirely on the measurement and what a typical change would be. So an RSI score is going to be different than a jump height score.
Got it.
If you don't have the ability to calculate these, or you don't know, you could set arbitrary cutoff values like we talked about, like 5%, 10%. If
Hmm.
it's within 0 to 5%, positive or negative, probably going to maintain what I'm doing, keep the program the same or slightly alter it. If it's above, we're going to have a good day. We're going to get after it, push some heavy numbers. And if it's below that threshold, like greater than 10%, I'm probably going to check in the athlete and see what's happening for that day. And we might back off on the workout, whether it be intensity or volume, depending on what we can manipulate. But either of those ways you can use as long as you're consistent over time.
Got it. All right. Well, thank you so much for taking the time to sit down and talk with me for a little while. And
Yeah.
where's a good spot where people can find out more about you, what you're doing, and if they're interested in, you offer remote coaching as well?
Yeah. For weightlifting. Yep.
Sweet. Yeah.
So they can find me on Twitter. I'm Tabor 85 kg. My old weightlifting class is still my Twitter handle. And you can find me on Instagram at Dr. Chris Tabor. So you'll be able to find me there. Reach out if you have any questions.
Awesome. Well, thank you again, and I'll talk to you soon.
All right.
All right. Thanks.